We just completed a study on access to maternity care in Utah, and we found three main barriers. First, distance to care. Women in 5 counties are commuting over an hour to get to a hospital where they could deliver a baby.
So just to put kind of some numbers around it, so 7 of our 29 counties in Utah do not have a birthing hospital, but kind of more importantly is when we measure travel distance to a birthing hospital, we find that 5 of our counties have an average travel time to a birthing hospital of over 60 minutes. And we do know that barriers to accessing healthcare is an important part of this, with the leading barriers being related to cost and transportation. When we think about families, a big thing is it's not just distance.
We know that when you have to travel further to get healthcare, that can consume a lot of resources that young families need. For example, if you have to drive 90 minutes to get to the hospital, that requires a reliable car, gas money, childcare for your other children, time off work, and a lot of the time these young families don't have those resources.
The providers we spoke with were across the state. They are so passionate. They are doing everything they can to help these families, and they just try to make it work. I will say in our report, there are lots of efforts going on in our state to help address some of these gaps. It may not necessarily be adding a birthing hospital, but how can we leverage and innovate is what I heard a lot in our interviews, so that we can reduce that burden and keep people in their communities.